Side effects of medication are also properly known as adverse drug reactions. We call them side effects as if on the road to therapeutic success with a prescription drug, we have a side effect, a branch off the main road. But in fact, they are adverse drug reactions. Adverse drug reactions are any reaction that children would have from a prescription medication that would lead to harm in them. And I think that it's important that people understand that actually side effects or adverse drug reactions are the 5th leading cause of death in North America. Now, some people suggest that that number is an exaggeration and have suggested that they're only the 8th leading cause of death. So it is a public health problem of huge significance, and it's important for you as a parent to understand these particular reactions and what you can do about them. Fortunately, most medications on the market today are in fact relatively safe, but individual differences in the way we respond to medications can result in particular problems. And it's not just death that's a concern, it's also permanent disability or disability that results in hospitalization that we're worried about with medication. So what you can do as a parent is actually observe your child very carefully after each dose of a medication, particularly when medication is just started, and look for adverse effects. Now, in an infant, it can be very difficult to discern whether their joints hurt or their muscles are achy, or even whether they have nausea, because those are concepts that older children and adults understand, but younger children don't. So the best way to observe them is what I call the stick man approach. Just start at the top of the stick man and work your way down. Is there any evidence that their head is bothering them, that they're having headaches, for example, eye problems, ear problems, nose problems, throat problems, and you work your way down the body to understand whether there's any adverse reaction in any part of the body, because drug reactions can certainly occur in any way in the body. If an adverse drug reaction occurs, or you're suspecting that one has occurred, it's best that you communicate with your health professional, your physician that's prescribed the drug, or the pharmacist as soon as possible, and let them know what you've experienced. They can often help to discern whether this is an adverse event that's occurring as a result of illness or a result of the drug that's being used. So observing your child carefully, monitoring their response after every dose to medication, and reporting those reactions to a healthcare professional can result in the best and most optimal therapeutic outcomes when using prescription drugs.